Good afternoon, everyone. Thank you so much for joining us during your lunch hour. We know that as clinicians, you are all very busy, but we truly appreciate you taking time out of your hectic day to learn about how we can better serve our patients. We have provided lunch, so please feel free to grab something to eat at your leisure. Today, we'd like to talk to you about health literacy. I'm going to turn it over to my coworker, Delcy, who will talk to you a little bit about this important topic.
Thank you, Shayna. As many of you likely know, health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information, as well as the services needed to make appropriate health decisions. As clinicians, it's important for us to ensure that our patients fully understand the information that we are providing to them. This helps to ensure not only that our patients follow the instructions we give regarding their medications, but also other instructions, and also that they are able to obtain the proper follow-up care. Patients with low health literacy have higher rates of medication error and less usage of preventative services. Today, we will talk to you about some teaching tools to better help identify and assist patients with low health literacy. Now, first off, it's important to remember that the people who are most affected by low health literacy have many of the same characteristics as people in our own community. Predictors for low health literacy include low education levels, low socioeconomic status, limited access to resources, as well as cultural and language barriers. Additionally, elderly individuals may also find it hard to navigate their own health care. When working with patients that possess any of these characteristics, as many of the patients that we see in our clinic do, we need to be especially aware of how we communicate. Now, I'd like to hand you over to An to tell you about the activities and learning objectives for today's training.
Our program today will focus on the teach-back method, which is a way to ensure that as healthcare providers we have explained information in ways that our patients are able to understand that what we have told them. Studies have shown that between 40 to 80% of the information that patients receive in a clinic is forgotten almost instantaneously. The teach-back method can also be referred to as closing the loop or show me method. This method has been tested and supported by various research. Additionally, the Agency for Healthcare Research and Quality has stated that asking the patients recall and restate what they have been told is one of their top patient safety practices. Next, I'd like to talk about some learning objectives for today's session. First, we hope that you leave today's session with a better understanding of health literacy and how to identify patients who may require extra support in understanding information. Second, we'd like to leave you today with comprehensive knowledge of the teach-back method, including how to use it properly. Before we get some practice, I'd like to talk about the specifics of this method. As I mentioned, the teach-back method is a way for us to assess patient understanding. We want to ask patients to repeat information in their own words, but in a way that is non-shaming and non-derogatory. We want to make sure that we are not testing the patient or putting them on the spot, but phrasing it in a way that assesses whether or not we as health providers have explained the information properly. It also offers a chance for us to reteach and rephrase information as necessary. I'm going to hand it over to Shayna to walk us through practicing this model.
First off, I'd like to model what this might look like, and then some of you will get the opportunity to practice and role play this technique. Dr. Shane has graciously agreed to be my first volunteer. Are you ready, Shane?
I am.
Okay. I just gave you a lot of information about diabetes, and I want to make sure I explained everything clearly. Can you please explain what you know about diabetes back to me so that I can be sure that I did?
I think you said that diabetes is caused by eating too much sugar. Is that right?
Sugar does have something to do with it. But diabetes is caused by a combination of your genes and your diet. Being overweight can put you at greater risk for diabetes. We talked today about some changes that you can make to help with your risk for diabetes. Can you tell me about some of these changes that you can make?
That's right. I should eat less foods with fats and sugars, like French fries and sodas. I should also walk for 30 minutes per day, 5 times per week.
Great. Okay. Do you have any questions about the example I just demonstrated? Wonderful. I'd like to mention a few other points to remember when using the teach-back method. First, it's important to use plain, easy to understand language. Also, we should always speak slowly, use short statements instead of long sentences, and focus on 2 or 3 important concepts at a time. We want to avoid asking our patients yes or no questions, such as, do you understand? Because it would be very easy for a patient to simply say yes. We need to ask questions to really figure out if our patients are understanding what we're telling them. Dr. Shane, would you like to practice using these strategies now?
Sure. Nurse Morgan, will you please act as my patient?
Of course.
Thank you. Morgan, today we talked about 2 new medications that I'd like you to start taking. And I want to make sure that I did a good job of explaining to you how to take these medications. Can you explain to me what each medicine is for and how you will use it?
Sure, I'll try. So I have to take 1 Lipitor every day in the morning, and that's to help lower my cholesterol. Is that right?
Yes, that's correct. Do you remember the name of the other medication that you'll be taking?
I don't remember the name, but I know you said it helps with my heartburn.
That's right. I'm also prescribing Prilosec, which will help your stomach to produce less acid, in turn making you feel better. How many times a day did we discuss that you should be taking Prilosec?
That's right, I remember now. I should take 1 Prilosec pill every day, and that I'm taking 1 Lipitor every morning. Does it matter when I take the Prilosec?
It's a good question. No, it doesn't really matter. You can take it whenever you'd like. It sounds like you have a great understanding of what we talked about today.
Thank you both. That was wonderful. Shane, you did a great job of speaking slowly and asking questions to ensure that your patient understood the material. Nurse Morgan, would you be willing to practice now? Let's try a scenario involving a vaccine.
Sure. Dr. Shane, would you like to be my patient today?
Sure do.
Okay, so today I would like to give you the flu shot vaccination. This is going to help protect you against this year's flu. The shot is quick and relatively painless, but you may feel some soreness in the arm where we give you the shot. However, if you do start to get a fever or start throwing up, then you can go ahead and call my office right away. That's a lot of information, and I'd like to make sure I did a good job of explaining everything. Can you tell me in your own words why this shot is so important?
It will help protect me from the flu, right?
Yes, exactly. And what are the kinds of side effects that you should be looking for?
I will call your office immediately if I have a fever or if I start throwing up.
Perfect. Are you ready for your flu shot?
I am.
Nicely done. So how do you both feel about the teach-back method? Do you have any additional questions?
No.
Okay, well I'd like to end our session by sharing a quote from the American Medical Association, who stated that it is neither just nor fair to expect a patient to make appropriate health decisions and safely manage his or her own care without first understanding the information needed to do so. This quote, to me, sums up the importance of using the strategies we discussed today. I hope you will take these practices and apply them to your daily interactions with patients. We have some literature on the table to the right. I encourage you to pick up a few handouts and our tip sheet on your way out. If you have any questions moving forward, you're welcome to reach out to me, Delcy, or An. Thank you so much for watching, and thank you to our participants.